The purpose of this poster presentation is to highlight the case study portion of the capstone experience. Background of the patient. Patient was a postpartum middle-aged female from Kenya who presented to the medical facility in labor. Upon admission, the patient tested positive for COVID-19 and was placed on airborne precautions. Both the patient and her family are from Kenya. This presented a language barrier as the patient spoke English, but the husband only spoke Swahili. Because of this, the patient translated education to the husband. Nursing assessment. This included both mother and baby assessment. For the mother, following delivery, the patient is G8P6, meaning she had 8 pregnancies and has 6 total living children. She also had a first-degree perineal tear that was not repaired. Estimated blood loss from the surgery was 150 milliliters, and the patient was GBS negative. The patient's fundus was firm at U-1 with small rubral lochia flow and no clots. The patient's breath sounds were clear bilaterally, and S1 and S2 were noted when heart sounds were assessed. The patient reported no numbness or tingling in the hands or feet, was voiding independently, and was passing gas. Slight edema was present on the lower extremities, however they were non-pitting, which is an expected finding post-delivery. Baby assessment. Baby boy was 3,435 grams at birth with APGARs of 8 out of 9. By the 24-hour mark, he lost 2.2%, which is a normal finding for a newborn baby. Temperature of baby boy was 99.9 degrees Fahrenheit, which is high for a newborn. However, it was determined that the cause of the temperature rise was due to the excessive swaddling by the parents. After removing the blankets and exposing his skin to room air, his temperature went down to a normal degree of 98.6. Hearing test. Bilirubin test and circumcision, including circumcision checks, were performed and passed at 24-hour mark. Table 1. Diagnostic tests. A complete blood count was completed and hemoglobin was 12.2, which is within the normal range. White blood cells were 18.9, which is high, which is to be expected with her COVID-19 diagnosis. Chemistry. Group B streptococcal, which was negative. This is important because Group B streptococcal can cause negative birth implications on the newborn. COVID-19 was positive. Nursing diagnosis. Number 1. Risk for bleeding related to postpartum status and a first-degree perineal tear. Number 2. Acute pain related to postpartum status and a first-degree perineal tear, as evidenced by patient rating pain as 4 out of 10. Number 3. Risk for impaired attachment related to postpartum status. Planning. Nursing diagnosis 1, short-term goals. Patient's lochia to be scant and fundus firm prior to discharge. Long-term goal. Patient to avoid putting tampons in the vagina or have sexual intercourse following discharge until cleared by the provider at the 6-week checkup. Nursing diagnosis 2, short-term goals. Patient rates pain as tolerable 30 minutes following medication administration. Long-term goals. Patient's first-degree perineal tear is fully healed by the 6-week follow-up appointment. Nursing diagnosis 3, short-term goals. Patient feeds the baby every 2 to 3 hours without being prompted for the duration of the shift. Long-term goals. Patient displays a bond with the baby at the 6 weeks follow-up appointment by holding, cuddling, talking to and about, and feeding without being prompted. Implementation. Interventions for nursing diagnosis 1. Fundal check. Fundal check was performed on the patient upon admittance to the unit, then once per shift, and presence of clot was assessed. Clots are assessed to determine whether placental fragments remain, which could cause more bleeding to occur. Routine blood pressure checks were also performed to check for hypovolemia, which could indicate bleeding. Interventions for nursing diagnosis 2. Assess pain frequently. A 0 to 10 pain scale was used, and medications were administered every 4 hours and 8 hours. Tylenol was administered every 4 and Motrin was administered every 8. Encourage rest and relaxation. Distraction techniques, change of position, and change of activity were encouraged in terms of non-pharmacological treatments for pain. Interventions for nursing diagnosis 3. Every 2 to 3 hours, the nurse would encourage the patient to feed the baby and to also check the diaper for voids and stools. Skin-to-skin contact was also encouraged between mother and baby. This was to improve the bond between mom and baby. Evaluation. Interventions that were effective for the patient's care included frequent encouragement in caring for baby, promotion of rest and relaxation, pharmacological and non-pharmacological pain management, routine assessments of both mom and baby, and frequent assessment of COVID-19 symptoms. The desired outcomes and goals, short-term, were achieved. Contact information can be found at the bottom of the page along with references on the next page. Thank you.